welcome everyone. My name is Craig Willingham. I'm the Managing Director for the CUNY Urban Food Policy Institute. We are a research and action center based here at the CUNY Graduate School of Public Health and Health Policy, and our work focuses on a wide variety of food policy related topic areas. Those of you who don't know about our institute, we've been around for a little over 5 years, almost 6 years. And we do these monthly forums as an opportunity to talk about food policy related issues that are important to you and others throughout the community. Today, we're going to be exploring some of the ideas and actions that came out of the White House Conference on Hunger and Nutrition that took place back at the end of September. And this meeting really was the culmination of almost a year's worth of work, a lot of feedback gathering on the part of the White House and other folks who are connected with the White House, helping to shape what this conference was going to look like, and was the first time in decades that there was a dedicated conference on hunger and nutrition. And it's something that many people have been wanting to see for a while, and we were all very excited to see that the Biden administration decided to have this. And now that we are sort of on the back end of it, and we know some of the things that the federal government has committed to, what does that mean for folks on the ground in states throughout the country? What are the sorts of ways in which the items that were discussed at the conference and the actions that were laid out, what are the sort of ways that we as advocates, academics, et cetera, can help make these become a success? And I want to also say that the folks that we have here today are a great panel, and I'm looking forward to many of the things they have to say about the direction forward after the conference. One last thing before I turn it over to our director, Nevin, I want to mention that we have another forum coming up in December. Rosita, could you go to the next slide, please? This is going to be a very special forum that focuses on the intersection between scholarship and activism, and will take the format of an intergenerational exchange. We're going to be honored to have Marian Nessel and Robert Gottlieb talk about their histories and their engagement with food and food activism. And we're going to have a couple of students from CUNY talk to them about what are the sorts of lessons that they've learned, and what are the sorts of ways in which young people can not only follow their path, but can work in conjunction with what they're doing now in order to create these sort of greater bonds cross-generational in terms of food policy and food activism. So we hope to see you then. The RSVP is on the screen there. We'll also be sending it out through our newsletter. It's on December 15th at 11 a.m. So looking forward to it. And with that, I'm going to turn it over to Nevin.
Thanks so much, Craig, and welcome everybody in the audience, and welcome to our speakers. We're going to jump right into this. We've decided that in order to focus our attention for this panel on ways to move forward, ways to actually turn the words of the conference into action, we would focus on 3 issue areas that relate to work that is underway at the Institute. But 3 issues that are really politically very salient and that a wide range of activists have been working on for a number of years. The first is universal school meals. The second is ending college student hunger. And the third is reducing corporate influence, and particularly the effects of predatory marketing. And so to get us started, we have speakers to address all 3 topic areas and respondents for each. And the first topic is universal school meals. How do we move forward? How do we expand access and the effectiveness of universal school meal programs? Our speaker is Alexis Bylander. She's a senior policy analyst at FRAC. And so without further ado, I'd like to turn it over to you.
Alexis and Nevin, I wanted to add one more thing before we get started. I also wanted to mention, as the forum progresses, we ask that you please jot down your ideas for potential strategies for implementing one or more of the 3 policy goals that we'll be discussing here today. We're going to open up the chat on the back end of the forum, and we'll allow for an opportunity for you to post your ideas and have a discussion with the panelists. So on to you, Alexis.
Great, thank you so much. Well, I am really excited to be here today and a part of this forum and plan to talk about what Healthy School Meals for All is and provide some background information, and then also talk about it in the context of being referenced during the White House Conference on Hunger, Nutrition, and Health, and some ideas for opportunities moving forward. So just to level set, there we go. So free healthy school meals for all is the idea that we would provide free breakfast and lunch to all students in school, regardless of their household income. And this is something that I'm really passionate about and enjoy talking about, because I really think that this is the future of school nutrition. And I think there's going to be a point where free healthy school meals for all have been in place for a long time, and people are going to look back and marvel at the idea that we used to have tiered payment options for meals in schools. As we all know, the pandemic really changed the landscape of so many things, but school nutrition was one of them. COVID-19 highlighted the critical role that school meals play for children. And in the middle of a crisis, we had the opportunity to do a trial run of what a free school meals for all policy would look like, because for a little over 2 academic years, students had access to free meals at school, regardless of their household income. The benefits of free meals for all students are many, but these are the ones that I like to talk about the most. It ensures that all students are hunger-free and ready to learn, because we know that if kids are hungry, they have a hard time staying focused and really taking advantage of all of the educational opportunities that schools provide. By providing free meals to all students, it reduces any stigma that is associated with school meals. It also ends the problem of unpaid school meal debt, which has become a huge problem for schools, for many families, and for many students. It also eases administrative burdens for school nutrition staff who no longer need to keep track of free, reduced priced, and paid meal categories. And it supports innovative service models like breakfast in the classroom. Last year, the Food Research and Action Center, where I work, had an opportunity to do some polling around free school meals for all. And our poll found that 63% of voters nationwide support legislation that would make free school meals permanently available to all students. I know that since then, several anti-hunger organizations have done their own polling on a state level and have found numbers either around 63% or higher, and particularly higher when polling just parents. All of you have probably seen the steady stream of earned media about this topic over the last couple of years. Here are just a couple of headlines, but I could have shown hundreds. There was a lot of support for free school meals, and then also a lot of anxiousness and disappointment when we went back to students paying for meals. And what's interesting is a lot of people don't know that many students in the country, probably around 30%, are at schools that provide free school meals to all students already. And those are community eligibility provision schools, also known as CEP. CEP allows the nation's highest poverty schools and districts to serve free breakfast and lunch. And instead of collecting meal applications, schools are reimbursed using a formula based on the percentage of students that are categorically eligible for free meals, because they participate in SNAP, TANF, and in some states, Medicaid. So currently over 16 million children attend community eligibility schools. So when we talk about providing free healthy school meals for all, we're talking about going from where we already are to 100%. FRAC sees 3 main pathways for achieving healthy school meals for all. The first is state legislation, and I'm calling that out first because I think there's the most momentum for that right now. That would mean that each state legislature needs to pass a policy that says they're going to permanently provide free healthy school meals for all. Another option is federal legislation that would create one federal policy that would cover all states all at once. The Food Research and Action Center and many other national partners lobbied very hard for this to be included in what would become the final version of the Build Back Better Act, but unfortunately we weren't able to get that included, but our advocacy continues. And then another pathway is incremental steps at both the state or federal level. An example of that could be expanding the number of schools that are able to do the community eligibility provision so that more students are able to access free meals until we reach 100%. This is a map that I just love that shows the momentum that is building for this issue. And a couple of years ago, there would have been nothing highlighted on this map, but that just shows you how much work can be accomplished in a short amount of time. The states here in blue, California, Colorado, and Maine, have passed permanent healthy school meals for all policies. The states in green, Nevada, Vermont, and Massachusetts, have extended the free school meals that were available to all students during the pandemic for one more school year, this current school year, 2022 to 2023, using state funds. And then all the states that have circles around them are states with active advocacy efforts around healthy school meals for all, and you'll be hearing from New York shortly. And what's also exciting is as of tomorrow, Connecticut will be added to this map with a circle around it because they are launching their campaign tomorrow. And then I just wanted to call out Colorado because it was just a few days ago that voters there approved free school meals for all through a ballot measure, which was really exciting and the first time that this has been done through a ballot. So now linking it back to the White House Conference on Hunger, Nutrition, and Health and the national strategy document that was released along with that event. We were really excited to see in that document, it references advancing a pathway to free, healthy school meals for all. And specifically, it says the Biden-Harris administration will take a major first step by working with Congress to expand access to healthy, free school meals for 9 million more children by 2032. So being included in this document was a really significant thing. I think we're hopeful that we can accomplish a lot on this issue in just the years ahead and not have to wait until 2032. But it was great to be included in this and mentioned. And when I think about what the work that all of us can do to make this a reality, I think about utilizing the tools that we already have, having more schools participate in CEP if they're eligible and getting those students free meals. I think about supporting the current state campaigns that are active and about lobbying the White House and Congress to pass federal school meals for all through federal legislation. So with that, I will turn it back to the moderator. Thank you.
Thank you so much. And, we are really happy to have Jessica Pino-Goodspeed, who's the manager of school meals policy and engagement with Hunger Solutions New York, to share her thoughts and respond to Alexis's comments. So, Jessica.
So much for having me. It's such a pleasure to be here, and especially after Alexis and all her leadership nationwide, we've really had a lot of direction in that way. I'm excited to be here with you today to talk about our state policy campaign, Healthy School Meals for All New York Kids. It aims to secure funding in the upcoming New York State budget, specifically the executive budget, to establish free school meals for every student across New York State. So this year in New York State, what the expiration of the pilot of free school meals during the pandemic looked like is a loss of nearly 726,000 kids losing access to free school meals across New York State. In New York, we're fortunate. We have strong uptake in the community eligibility provision. About 60% of our schools across New York continue to offer free school meals thanks to the community eligibility provision. About 90% of our eligible schools are participating. So there is buy-in across New York State that universal free school meals works, and schools that are able to do it are doing it in New York. But with the expiration of those federal flexibilities, what resulted is 2,000 schools that have lost this ability to offer free school meals. So this is where these students are, these 726,000 students are living, many of them in households that are just above income limits. So to share with you a little bit what we're seeing this year, we work one-on-one with districts across the state. We've also done some time to survey them about what this transition looks like, going back to a tiered payment system and losing free school meals. So in that survey, we were able to capture about 177 school districts across New York, about half of them reporting an accumulation of school meal debt at higher rates than what we saw at the pandemic, prior to the pandemic. Schools are also reporting that the majority of those families in debt are families who are unable to pay for school meals, but do not meet the income limits in the tiered payment system. So each day we're really hearing distressing, heart-wrenching stories from districts of parents who are denied meals, not denied meals. We do actually have legislation to protect kids to make sure they get meals at school, but the debt is accumulating and schools are stepping in as debt collectors, and families are really needing to make tough choices between rising costs at home and debt accumulating now at school as well. So the bottom line is that across so many sectors in New York, we see how inherently broken going back to tiered payment system for meals is. So our campaign is calling on a new normal, like Alexis has talked about. We have strong support for this policy in New York, and we're hopeful. More than 200 different groups, from education, parent-teacher groups, labor unions, anti-hunger groups, nutrition, health, equity advocates, have all signed on to our campaign to call on Governor Hochul to fund universal free school meals in the upcoming executive budget. So now is really the time for New York to lead. We have a lot of momentum and support. We're asking for you all, if you're in New York, to join us in calling on Governor Hochul to make healthy school meals for all a reality in New York. We're really getting rolling with some grassroots advocacy, writing to the governor herself, and we really would love your help to amplify this message in New York. I'm going to put in the chat where you can learn more about the campaign, and specifically where you can sign up for updates. If you represent an organization, you can join our list of 200 sign-ons. If you're an individual and looks to be engaged and would like to write letters and be engaged in that level, you can also sign up for our updates in that capacity as well. So I really just wanted to take the time and say thank you for letting us amplify the work that we're doing in New York to make this a reality. We really see this as the time now for New York to step up and take care of our kids.
Well, thanks so much, Jessica. And again, I want to remind the audience members that if you have other ideas for stakeholder organizations or sectors that could be involved in a campaign like this, or have other suggestions on how different municipal and state actors, advocacy organizations, and other entities, local governments, can help to move forward with implementation of universal school meals. We'd love your comments and suggestions and questions at the end, and we'll be opening up the chat towards the end of our presentations. Our next topic is on ending college student hunger, another very important, very politically salient issue that advocacy organizations have been working on. And our speaker is Susana Martinez, who's an associate professor of epidemiology and biostatistics at UC San Francisco. So Susana, please join the conversation.
Okay, thank you. Let me get my slides up. One moment. Doesn't look great. Okay, there we go. All right. Good morning, everybody. I think it's still morning. My name is Susana Martinez, and it's a pleasure to be here to talk about ending college food insecurity and some things that we're working on in California that are aligning with the national strategy that came out from the White House conference. So just to give a little bit of background for those who aren't familiar with the issue of food insecurity in higher ed, there was a report that was conducted in 2019 by the Government Accountability Office, and what they found was that across the nation, more than 30% of students were experiencing college food insecurity. They couldn't really put a pinpoint on it, but they knew it was somewhere between 30% and 50%, which is quite a bit compared to the national average, which is usually between 10 and 11%. What they also found in this report was that of the almost 20 million students at the time in 2016, that 3.3 million of them were potentially eligible for SNAP, but less than half of them reported participating. And so the title for this report was called "Better Information Could Help Eligible College Students Access Federal Food Assistance Benefits." And so with that, they provided 2 recommendations to the USDA Feed and Nutrition Service. And one was to improve student eligibility information that's provided on their website, which they did do. And then the second recommendation was to coordinate with regional offices to share information on different approaches that states are using in order to help students get access to SNAP. And so that request or recommendation is still open. And so we're still waiting to see some solution there. One of the things that the report did talk about was that today's student is very different from students 20, 30 years ago. And so today our students are what some or the Board of Education might call non-traditional students, but what we like to call our students who have different intersectional backgrounds. So we have students today who are more likely to be first generation to attend college in their family, community college transfers, Pell recipients, more students from underrepresented backgrounds. And in addition to that, and not included on this slide, is we have more and more students today who are also parenting students. And these are just some of the demographics for the California State University system and the UC system that are both the public universities here in California. So a little bit about the work that we've been doing in order to advocate for funding at the state level here in California is we've created a group that we call the California Higher Education Basic Needs Alliance. And really what this is, it's people from the UC system, leaders from the Cal State University system, and from the California community colleges. And we gather monthly to talk about just everything that's happening in the state in terms of policies and policies that we are aligning with and ways to get funding in order to address student food insecurity, but also policies to address how to help students get access to SNAP. And so we started convening in 2017, and over time we've been putting out these reports, just reporting the prevalence of food insecurity among college students in California. And then in 2020, we had the UC Board of Regents who governed the University of California. They put out a report in 2020 with some really clear goals. And one of them was to cut food insecurity by half. I think it's by 2025, but I think that's a little too ambitious. So I put 2030 because I couldn't remember the exact year. But nevertheless, this goal to cut food insecurity by half by 2030 was something that was also highlighted by the Biden administration at the White House conference. So why do we care so much about food insecurity? I think this is important to talk about because we know that Pell Grant doesn't go as far as it used to go. Pell Grant only now covers tuition and fees, whereas before it covered cost of attendance. And so now more and more today, we have students who are experiencing food insecurity. And some of the things that we know are connected to food insecurity during higher ed are factors such as being food insecure as a child. And so that just shows the persistence of the issue over time. We know that our Black and Latino students are more likely to experience food insecurity with a big disparity in terms of like undergraduate and graduate students. While they're both populations have food insecurity, it's double in the undergraduate population. And then students who are on Pell Grant also have a higher risk for food insecurity. And some of the things that we know that affect the student in terms of health, or not just health, but academics as a student, are they have a lower GPA, they're more likely to have poor mental health and physical health, obviously poor diet, and less physically active and have insufficient sleep, which are all important factors for your health over the life course. To bring this back to the White House conference and aligning it with some of the with some of the pillars that that were highlighted, so there were 2 pillars that some of the work that we're doing aligns with. And so one was to empower all consumers to make and have access to healthy choices. And then the second pillar, pillar 5, was to enhance nutrition and food security research. And so some of the work that we've been doing in the UC system is our food pantry work. We've established a food pantry on all 10 campuses, and we've been evaluating some of the work that's being done. And what we're finding is that the food pantry really is serving as an emergency response, and for some students, even a preventive strategy for avoiding food insecurity. And we find that those students who come to our food pantry more often are those students who are exactly what the Government Accountability Office identified as the non-traditional characteristics, which are first generation students who are experiencing housing insecurity, and those who are receiving financial aid, most likely Pell Grant. And we also know that the students are coming to the food pantry because they don't want to run out of food. They're experiencing financial insecurity. They're using the pantry as like, their usual place to restock items. And then simply, students being busy working part-time and being full-time students just don't have the time to prepare food. And then lastly, some of the things that we have seen, which is really important, is that we've seen improved health outcomes to students reporting better sleep, fewer depressive symptoms, and better general health because of the food pantries. So we know that food pantries are an emergency response. They're not really meant to be a long-term response. And so we've also been doing a lot of work around SNAP, especially because the GAO report announced like, hey guys, like there are a lot of students who are eligible for SNAP. We just don't know how to get them on it. And so some of the work that we've been doing in California is we have on every campus, we have a staff who do SNAP outreach. And when we did some qualitative work with these SNAP staffers, and what we found was some of the things that would help in the application process was when county staff came to the campus to help students with the application process. And so one of the things that we recommended in a report that we put out was to simply have more staff on campus, office hours, county staff coming to office, helping students during like CalFresh, or we call CalFresh, SNAP CalFresh in California, but having these clinics where students could come in, ask questions, and get processed. The other thing that we found out was California is a huge state. We have like over 50 counties. And so every county is a little bit different in how they interpret student eligibility. While they think they're following the rules, some of them are like, they have to verify whether they have a job or work study, like they have to see pay stubs, which other counties, they just take the word for it. And so all this heterogeneity. And so one of the things that we also recommended was for a state mandated training in order to keep it more streamlined. But then with the pandemic, that kind of all went out the window. We had our pandemic modifications, which were waiving student verifications and interviews. And what we found was that before the pandemic, if you look at the slide, before the pandemic, it was just like a circle, like students couldn't get on SNAP. They didn't know how to do their applications. State staff were trying to help them figure it out. And it was just this back and forth. And it took a really long time to get students approved for benefits. But then with the pandemic, they got rid of a couple things, and it just made the process so much more streamlined. And so one of the things that we're advocating, or that the staff from the county thought would be a really good idea, is just to eliminate the student eligibility rules. But that's an area where we could continue to advocate. So just want to bring this back to some of the legislation that's happening in the country. So a lot of the work that we're doing in California isn't possible without the state funding that we've been receiving. And so there's a couple of legislation bill drafts that are out there at the federal level that would provide campuses some pilot funding, or not just pilot funding, but award funding to institutions to be able to do some of the work that we've been doing in California. And I've listed them here. And one is called the BASIC, in case you haven't heard of it. That provides funding to institutions to address student basic needs. And then the second one is called EATS for short, which would eliminate the work study 20-hour rule that students have to meet in order to apply for SNAP. And then the last one is the Student Food Security Act, which would provide funding to campuses to pilot programs on campuses. So with that, I will hand it over to Nevin, and thank you very much. And I'll be here to answer questions.
Thank you so much, Susanna. And Peter Granville, we're going to turn to you. You're at the Century Foundation, and the foundation has done a lot of work on college food security. Your comments and thoughts, or any other strategies that you and your organization would recommend?
Yeah, thank you, Nevin, and thanks, Susanna, for that excellent presentation. Thank you to the Urban Food Policy Institute for hosting. I really want to build on Susanna's remarks by honing in on, what can be done now through federal policy to make sure that every college student has accessible resources to meet their nutritional needs. This is such an important time for this dialogue, not just because of the White House conference, but also because of the Farm Bill reauthorization expected next year, which is a big opportunity for policy change and thus an important time for advocacy. Before I dive into SNAP, I just want to mention some other federal laws that can have an impact. One approach is for the government to give colleges money and say, take this and feed your students and get them what they need. It feels like so long ago, but in the early pandemic, Congress gave $76 billion with a B in emergency aid to colleges and students. That money saved many students from food insecurity and hunger. Not all students, but definitely many. Perhaps we can have ongoing federal funding for emergency aid, since students have financial emergencies all the time, which can plunge them into hunger. In a similar vein, Susanna highlighted the BASIC Act, which would deliver institutions funding to help students meet their basic needs, including food. Another bill called the Food for Thought Act would fund on-campus meal programs. Increasing the Pell Grant would help reduce food insecurity too. So would eliminating community college tuition, and we know community college students are especially susceptible to food insecurity. And SNAP is the most versatile tool to combat student hunger, but college student eligibility for SNAP is very complex, as Susanna alluded to. College students enrolled at least half-time are considered ineligible unless they work 20 hours per week or can show an exemption, such as being a student parent or receiving work study. When that law was designed 40 years ago, those exemptions were meant to indicate non-traditional student status. And as Susanna showed, the majority of students today are what we used to call non-traditional. So actually many can qualify, but they have to go through this arduous process to apply. And they probably won't ever try if they don't learn about their eligibility, and quite few do. Another aspect is SNAP is functionally separate from the federal student aid program. You fill out your FAFSA to find out if you're eligible for financial aid, and then months later, you can start this whole other process to find out if you're eligible for SNAP. In 2020, Congress made temporary changes that brought these two systems a little closer towards harmony. That includes a new exemption for students with $0 EFCs, which is an indication of low income status according to the FAFSA. So for a limited time, colleges and states can email 0 EFC students and send them letters saying, you have this exemption, consider applying for SNAP. Congress could make those temporary changes permanent, which is proposed in the Student Food Security Act. Now, there's this other approach, which Susanna mentioned. What if we said, it just doesn't make sense that we're restricting SNAP access for college students? They're investing their time into their education. They're working their butts off to learn and gain skills. Let's count higher education as work. So that's what the EATS Act would do, and it would have a huge impact on how students pay for their meals. There are other ideas out there. I have friends in this policy space who suggest, for example, lifting the ban on financially independent students. Another idea is, creating a whole new program where SNAP for students becomes really embedded in the financial aid system, and low-income students can have a SNAP EBT card essentially waiting for them when they arrive, and that'd be based on their financial aid data. So there are a lot of good ideas on the table as we look to the Farm Bill next year. I'll just close by saying that the SNAP student eligibility rules were designed under this paradigm that, the vast majority of college students don't need government assistance to meet their needs, and should thus be excluded. We know that no longer holds true. So how much of a paradigm shift is there sufficient political will to support? Will we adopt policy changes that really reflect the paradigm shift of the last 40 years of rising college costs, a weakened Pell Grant, and far more economically diverse students? We'll find out the answer next year. I hope you've learned a thing or two about the opportunity Congress has with the Farm Bill to change the system for the better. And if you want to see change, then I hope you feel empowered to engage with your officials on those ideas. Thank you so much.
Thanks so much, Peter. And again, a reminder to everyone in the audience, your ideas are important to us and we'd like to include them in this dialogue. So if you have thoughts on how to implement some of the policies that were just discussed, please put them in the chat, and we will be opening up the chat after our next set of speakers and look forward to hearing your ideas as well. So we'll turn now to the third and last topic, reducing corporate influence and predatory marketing. Two issues not, in my opinion, really extensively addressed in the White House report, but we're turning to Nick Freudenberg, who's a distinguished professor of public health at the CUNY Graduate School of Public Health and Health Policy, a close colleague of mine, and who co-founded the CUNY Urban Food Policy Institute and is currently our senior faculty. Nick has written a lot about corporate influences on health, and so please share your thoughts with us.
Thanks, Nevin. And as always, a pleasure to be here. And thank you all for your thoughts. And I look forward to our discussion. So following what Nevin said, I think whereas the previous two topics, school food and campus food insecurity, were well addressed in the White House report, I think in this area, we see an area that needs a little bit more work. And I want to begin by telling you, briefly highlighting what's in the report, the National Strategy on Hunger, Nutrition, and Health, and then proposing some solutions for us to think about and talk about. And there were three different broad strategies they talked about. First being to empower consumers with updated and more accessible food labeling. The second, and I think at the heart, creating healthier food environments and a healthier food supply. So the healthier choice is the easier choice, a kind of mantra in public health that we want to make healthy choices easy choices. And finally, to support robust and tailored nutrition education, particularly that supports those prior two goals. And then if we look at the specific wording on addressing marketing of unhealthy foods and beverages, this is quoted from the report. And they note that food companies spend at least $14 billion per year on marketing, probably the true expenditures when you include social media, influencers, public relations, all those other things, is much higher than that. And we know that the vast majority of this advertising goes to advertise unhealthy food, that it's targeted at children, people of color, and other populations already at higher risk of dietary disease. And they come up with two recommendations. The first being that the Department of Defense should limit marketing in military dining facilities. And the second, they say the FTC has indicated that it will pursue targeted law enforcement actions to prevent deceptive marketing of food. Those seem, in comparison to some of the other things we note in the report, to be quite weak and generic recommendations, and not by themselves likely to have a big impact. And I think this speaks both in the White House conference itself, but also in the larger national discourse, the incredible power of the food industry in shaping the discussion. And I think really, if we're going to make progress on reducing consumption of unhealthy food, we're going to have to think over the long term of more effective strategies of limiting what the food industry can do to pursue its profits. And I think there are just some facts, and my guess is that many of you are familiar with these, but every time I look at them, they strike me both for their gravity and for the potential they create. Unhealthy food, which is mostly regarded as highly processed foods, foods high in fat, unsaturated fat, sugar, salt, and in all the additives and preservatives and colorings, is the leading cause of premature death and preventable illness in New York City and state, the nation, and increasingly around the world. Diet-related diseases are a leading cause of the differences in health between Black, white and other communities of color and better off people, and between low income and better off people. And that's true in New York City and state, and also in the nation. And again, a very sobering statistic from a study that was done in 2017, about 60% of the calories consumed in the United States come from highly processed foods, exactly those foods most associated with diet-related diseases. And this level of calories that come from highly processed food is the highest in the United States than any other country in the world. And in fact, in some middle income countries, it's substantially lower. So we're really leading the world in the proportion of our diet that comes from food that we know is associated with ill health. And if we look at data from here in New York City, sugary beverages, soda is probably is the leading source of sugar in our diets in New York and the nation, and also a leading cause of the high rates of diabetes and the increasing rates of diabetes among young people. And we see dramatically different rates of consumption, both because of the availability and because of the marketing between communities of color and white, and in this case, Asian communities, and also between better off and lower income communities. And I also wanted to emphasize, I think the COVID pandemic has highlighted the challenges. On the one hand, we know that people who are overweight and obese, people with diabetes, people with heart disease, hypertension, were at higher risk of COVID. And that tens of thousands of people here in New York died because we had not taken on, as a city and state, our unhealthy diets. We knew about it, but we had not taken that on because of the opposition from the food industry. And then the second, I think, salient point is during the COVID pandemic, the very companies that were making these foods, Coca-Cola, Pepsi, Kellogg, Nestle, recorded windfall profits from marketing their products, some of which were more accessible, easier packaged, available in stores. And so the very products that contributed to pandemic, the companies making them made much higher levels of profit. And that leads me to believe that reducing the proportion of calories that come from unhealthy food here in New York and the nation has the potential to save hundreds of thousands of lives, prevent illness. And so the question is, how can we achieve that goal? And I wanted to leave you with a list of some ideas. I think, in fact, there are a lot of ideas, and what we need to decide as a food community, a food justice movement, and other groups, which of these we're going to pick up and how. So more stringent rules for restricting false and misleading advertising and false health claims, so that parents can make more informed choices about what they feed their children and families. I think state attorneys general have a powerful role to play, and using their consumer protection power, they could act much more aggressively in filing lawsuits against companies with misleading advertising, particularly directed at children and young people and other communities. Like many other countries in Latin America and London in its public transit system, we could ban junk food advertising, both in public transit and online and on television. And you'll hear more from the next speaker in this sequence. We could also pass legislation that would allow only promotion of healthy products in public property, such as mass transit, schools, and school buses. We could strengthen FDA labeling requirements to make food labels a more useful tool for parents. There's some particular products, toddler milks, products aimed at 1, 2, and 3-year-olds. And increasingly, there's evidence that these not only don't support health, but they actually undermine health. And we need much stronger rules on those products. We need to mobilize public health and pediatricians and other health organizations to advocate for restrictions on predatory marketing. Much of the marketing of unhealthy food is now done online and on social media, and we need to bring those regulations into the 21st century. We made some progress in the last few years. We could do much more. The increased monopoly concentration of the food industry has made it much easier for that food industry to devote more resources to marketing, and we need to look for ways to limit it. Number 12 on this list, it is amazing to think that Pepsi and Coke and McDonald's can deduct the money they spend on convincing our children to consume foods that make them sick. They can deduct that from their taxes. There's been legislation introduced a few sessions ago in Congress to remove that restriction. That would be a big step forward. And we can also encourage child health providers. And these suggestions you can read more about in an article that my colleague Jim Krieger and I wrote about in a recent issue of the American Journal of Public Health. I'm very honored to have following me one of my public health heroes, State Senator Zelnor Myrie. He became my hero by dressing up as a carrot on Halloween to announce the bill that he's going to tell you about. And I now turn it back to you, Nevin.
Thanks, Nick. And I will now turn it over to Senator Myrie. We're really honored that you joined us this morning.
Thank you so much. It is my honor to be with all of you. I always jokingly say that it is good to be the least smart person on the panel. And so I am really in good stead and to be with all of the experts today. I'm State Senator Myrie. I represent a couple of neighborhoods in central Brooklyn, about 320,000 people. I was born and raised in my district. And so it has been, again, the honor of my life to represent this district. I'm now in my 4th year. I was just reelected. So I get another 2 years of service with the people. And the reason why I start with some of my background is because on my way to school, and I still live in the building that I grew up in, on my way to school every day, I had to walk past a Checkers, a McDonald's, a Dunkin' Donuts, and a Wendy's. And that was just 2 blocks away from my school. And to me, this really crystallized the problem that we have, particularly in communities like mine, but not exclusively to us, and that is the targeted marketing of unhealthy foods and the subsequent maladies that we suffer as a people because of it. And as was mentioned previously, this really came to bear during the pandemic when members of my community were dying at disproportionate rates than everyone else. And we were trying to figure out why that was. And that was in part because of these diet-related illnesses, hypertension and obesity and reduced lung capacity that can be drawn directly to unhealthy diets. And the role that our corporations play in this is something to me that we as a government, we as leaders should not at all accept. We should not accept that people make money off of our death and our illness. We should not accept that they continue to do so unabated by regulations or by the regulators. And so I felt that it was important for me to step into this space and to try to put in some extra regulation. Now, in a different context, with the gun industry, we used a similar approach. Gun violence is something that we all are all too familiar with, but something that my district lives with almost daily. And as we thought through the solutions for that, I said, well, why are we letting this industry that knows the problem, that is, its legal products makes its way to the illegal market, knows the consequences that those illegal products end up killing a lot of people, yet they are protected from any ounce of accountability by our legal system. So we passed a first in the nation bill that allowed New York State residents to hold members of the gun industry accountable for irresponsible practices and procedures that would lead to gun violence. And as I was doing that research, I of course looked into what was happening in the pharmaceutical industry. And we saw that it was the same sort of corporate behavior, that they knew what the problems were, but they put profits over people. And the result of that was death and damage for thousands and millions of Americans. And I believe it is the same thing with the bad actors in the junk food industry. We have thus far not taken them on for a whole host of reasons, some of which I believe are well-founded and might be argued that it's harder to do legally than in some of these other spaces, but others that I think are just a result of our complacency and a result of us really allowing them to drive this narrative. So we introduced, as you saw in a carrot suit last Halloween, the Predatory Marketing Prevention Act. And I will say on the outset that even the name predatory marketing can really be credited to the Institute. A lot of my research in drafting this bill came from the work that the Institute has done. And that phrase itself, I lifted from the Institute. But the Predatory Marketing Prevention Act just has a couple of principles that it stands for. And one is that you should not be targeting vulnerable populations, particularly our children, with this type of advertising, unless you're disclosing what the consequences of overconsumption of that advertising is. We also require the state's Department of Health, the state's Department of Education, and our Agricultural and Markets Department to work together to come up with an educational plan for our kids. Some folks may be surprised to know that the statute that was the basis for New York's anti-obesity campaign had within it that you cannot mention in that anti-obesity campaign the bad results of over-consuming junk food, which to me, I wasn't around at the time, but to me seems like a line written directly by a lobbyist from the food industry. And so our bill would strike that as well, so that there can be transparency and honesty in addressing our diet-related problems. And it empowers the Attorney General and private entities as well. If you can set out a certain set of circumstances, depending on the type of marketing, depending on the way that it was marketed, that you can seek damages for what has happened and the results of that predatory marketing. So I'm really excited about this because I think we are at a point in our country where we're starting to grapple in a serious way with some of these diet-related maladies and the causes. And I view my role as a representative of a community that has been targeted, as a son of a mother with diabetes, as a community leader that had so many folks in our space pass away prematurely because of these diet-related issues. I think it's time for us to step up, and I think it's time for us to be unafraid. I am certainly not afraid of this industry, and I think it is important that we always, always, always put our people before the profit. So I'm excited to be in the fight with everyone here, and thank you for giving me the opportunity to talk to folks.
Thank you, Senator Myrie. And we've heard a lot of really exciting and some really novel approaches to addressing these issues at various scales, at the institutional scale, at the state scale, and also advocacy efforts focused at the federal government level. And now we're going to open up the discussion to you in the audience. So please post any comments to the speakers, questions for them, and reflections on, again, ideas for implementing, for actually putting into action the goals expressed in the White House Conference's report. But we'd like to hear from Jan Poppendieck, who's also a senior faculty fellow at the Urban Food Policy Institute, for an overall reflection and maybe overall question to the panelists in response to their talk. So thank you, Jan.
I think you're muted, Jen.
Okay, good. I tried, but it was. So I do have, I have two questions, actually. I think I'm going to get them both in here. And I'm going to do the more specific one first, and I'll address it to Peter, and then hope that it will actually apply. I think it does to all of it. There are now at least 4 constructive pieces of legislation at the federal level that would make a serious dent in campus food insecurity, in college student hunger. What's the process for coalescing, combining, negotiating among these multiple bills to get a unified campaign? So save that question, and now I'll do the one that I know embraces everybody. The discussions of the original White House Conference on Food, Nutrition, Hunger, the 1969 conference, very often begin with an assertion that there were 1,800 recommendations and 1,650 of them were implemented in some way. And the implication is that the conference itself brought about these great public policy changes. But of course, it wasn't the conference. The conference was a result of the forces of the political and social context. I think of the civil rights movement and the way in which it brought a spotlight on poverty in the United States, the very dramatic discovery in the late 1960s or rediscovery of hunger in America, and the work of the media in publicizing this, the creation of a platform for champions in the Congress, particularly the Senate Select Committee on Nutrition and Human Needs, and the organized advocates. I was delighted that we had FRAC and New York Hunger Solutions here with us today. But these are the forces that enabled the recommendations of that White House conference to find their way into law. So I want to know, what's your assessment of the political and social context for achieving the kinds of changes that all of our speakers have talked about today? And I did try to put that in the chat with no success. I'll try again. And that one is open to any and all.
Yeah, I don't know, Peter, would you like to start? And then maybe we could go around to the other panelists.
Yeah, so thinking about this array of options that are on the table right now when it comes to addressing college student hunger through Congress, through legislation. Yeah, we have these great ideas. Some range from maintaining the current system of SNAP eligibility, for example, and tweaking it and making it better, versus essentially clearing house and saying that rule does not work right now. Let's just, with the example of the EATS Act, treat college as work. And so I think one key factor here is that I think a lot of people come at this with perhaps a more, with a bias against opening up the gates to students receiving food aid, because there are oftentimes like anecdotal reports of, oh, look at this middle income or wealthy student who got SNAP. This seems like abuse of the system. How could we let that happen? We certainly shouldn't make it easier for students to get that. Certainly in the late 2000s, I think that was a factor in some states really scaling back their sort of availability or the extent to which they use the federal rules to get as many students as they can onto SNAP. That being said, we have so much more research now than we did. Great work by folks like Susanna to sort of encapsulate the problem of food insecurity. And if we can get to, as I kind of mentioned in my remarks, like that paradigm shift where we realize, yeah, students deserve more of a government support system than they have now to get the food they need so they can be in class and actually learning and not thinking, my stomach hurts, I'm so hungry, this sucks, right? No, I think part of it is moving from this kind of inside baseball nature of the dialogue right now, where very few people know about these SNAP student rules. Many people think that students are just ineligible broadly. That's one reason why we have such a low student participation rate. One thing is just educating people about these proposals and the system as it is right now. I think that's going to be a really essential step. And then from there, coalition letters, people talking to their elected officials in Congress and maybe coalescing around one idea. The exact nature of You know, Congress is still in flux. I mean, I guess now we know that the House will be a Republican-controlled chamber and the Senate will be Democratic, but you know, those margins are going to affect what kind of parameters of the conversation might be possible. So I think I can't say for sure right now sort of exactly how that will play out, but I'm hoping that as more people learn about, oh, here's how the system is right now, here are ways that we can fix it, or we can at least make tweaks that we know worked, like the $0 EFC exemption. Then I'm hoping that'll be a very kind of productive dialogue, and that we can even then evaluate these sort of assumptions that created that rule, like that students are supported by their families, they don't need this, and we have such great research now showing the opposite.
Thanks. Any other thoughts on sort of how we move to engage coalitions, move across different issue domains, and collectively move policy forward?
I have a few quick suggestions in response to Jan's solution. First, as a public health professional and researcher, my read of public health history is that people's well-being improves when social movements, reformers, and elected officials get together with a shared agenda. So I think that is the broad lesson, and we all need to find ways to do that. And it's not like we need to create one organization or we need to agree about everything, but we need to identify priorities. And I think here at the Institute, we're really interested in partnering with other organizations, coalitions, community-based organizations, to begin to identify that agenda and to look for, the next session of the state legislature, the next city and state budgets, and the new session of Congress to say, here are a few things we can agree on. And even if your organization is working on other things, you'll support this effort around school food, around campus food insecurity, around restricting predatory marketing. The second, I think, is the critical importance of young people and bringing young people in. And it's been young people and their energy and passion and commitment that have been so important in the last 2 decades on immigration reform, on combating racism, on gun violence, and on food. And we all need to be working, and we're privileged to be based at CUNY, with 250,000 young people in New York who are committed to improving their lives and improving their communities. We need to find ways to tap into that energy. And the last sort of broad strategy suggestion is we need to, those of us who are advocates need to increase what I call our chiropractic capacity to give elected officials backbone to stand up to special interests. And we're lucky in New York City and state, we have a few legislators with backbone who are willing to take on these industries and who are willing to move forward in legislation. And those of us who work in the academic settings, in advocacy organizations, need to connect with those elected officials so we can together develop an agenda that can move things forward. And again, at the Food Policy Institute, we're very interested in partnering with other organizations that want to pursue these 3 tasks. Those are some thoughts.
Thank you, Nick. Would any of the other panelists care to respond?
I mean, I think everyone has said it well. I just, I'd be derelict in my duties as a state legislator to not say, don't forget about the states. And none of the panelists have done so, but, and in fact, are doing excellent work in the states. I just always make my pitch for policy work at the state level because we can often be an afterthought. Or folks think it's not as sexy or as headline grabbing, but in fact, it really is where you get to make a lot of the headway. And so I just say, please don't forget about your state legislators. We're ready to rock.
Thanks. I'd like to sort of pose a question that follows on the comment you just made, Senator. To what extent are organizations working on political mobilization in general, in addition to policy design and policy advocacy? And how important is mobilizing young people, constituents who haven't been as involved in the political process in addressing food issues?
Yes, I'll say, and I don't want to hog the mic here, but on the young people's front, we just did a roundtable on the Predatory Marketing Prevention Act a couple of weeks ago in my district, and we had really preeminent medical professionals at the table, and we had two panelists. One who was a young person from Brownsville who was incredibly articulate about the needs and what we should be doing to increase access and decrease the influence. And we also had a leader of an organization that works, it's called Teens for Food Justice, that does this type of work in our communities. And their input, their feedback, their buy-in, learning how they organize, it really is critical to us advancing this. We were able to get the bill out of committee last session. I think we have the opportunity to do so much more because the young people are actually excited about this and they're getting to be involved. And so, I'd underscore again to continue to loop them in and to keep them at the fore, and we're really following their guidance on this.
I can add too that I think K through 12 students for free healthy school meals for all campaigns are just absolutely critical. And I had the opportunity to join the Minnesota Coalition working on this issue when they did a listening session with the Minnesota Lieutenant Governor. And one of their speakers was a middle school student who talked about what it was like to not have enough money to pay for lunch and the way that that impacted his whole day. And he was one of the most powerful speakers in that session. And so there is a space in this campaign for students to grandparents and everyone in between. And it's not just students who are in need of free meals at schools that can be great testifiers and advocates. It's other students who are currently seeing the injustices that are happening in school cafeterias and want a more equitable and positive food environment for all students, themselves and their peers.
Great. We have a comment, a question from Ruben Canedo, who asks, how can we organize towards expanding resources from the federal government to these areas, I assume topical areas, and away from larger funding areas like defense spending? And so the question, as I'm interpreting it, is how do we move upstream and address broader issues like the federal budget and its role in supporting students in college, young people in elementary schools, and how do we sort of tackle these bigger policy issues in the context of food?
I'd like to elaborate on his question. I think he captured most of it. I think also he's interested in how do we gain more enthusiasm and advocacy around doubling the Pell, because as we mentioned earlier, Pell hasn't, the purchasing power of the Pell Grant is at a forever low, and not forever, but all-time low, and it just doesn't cover as much as it did 30 years ago. And so how can we get more momentum around, there's a current campaign right now to double the Pell. So how can we put our, efforts together to advocate for that and slowly decrease defense funding, because we know how big that budget is. I don't have the solution.
Yeah, I'll just piggyback on that and say, I really loved Alexis, your slide showing kind of the polling-based popularity of universal free school meals. I think we need more of that in this kind of policy space, showing these ideas are popular and hopefully get sort of grassroots momentum from the ground up. And when you talk to students, they tell you incredible stories of what they go through and the challenges they face and their perseverance. And I think they should be a very sympathetic population. We just need to do more to uplift their stories and their testimonies. And, of course, cheers to everyone already doing that in this space. And I think that's going to be key.
And at the risk of sounding political, I think the experience, there's a lot to be learned from the experience of the election we just had, and we really need to be thinking about 2024. And for those of us working in food and nutrition and public health, I think democracy is an essential foundation for making progress. And until we have a Congress that represents the majority viewpoints of the American people, and in order to achieve that, we need to have more people voting, particularly young people. We had good turnout of young people, but and it was more than in 2020, which is an amazing accomplishment, but it was still fewer people 18 to 24 voted than people over 24. And that is room for improvement that we all can be working on in the next couple of years. I also think there are really important lessons from the pandemic, both at the community level and the policy level. When communities came together and made demands, here's what we need to survive this threat to our health, government responded. And some of the government programs, the federal government programs that came about as part of pandemic relief, actually reduced child poverty, actually improved the health of children, actually reduced the misery that so many people were facing. And we now need to think about how do we apply that, not just in time of crisis when we take special measures, but at all times, so that nobody has to be living in poverty. And those are aspirational goals, but we need to work on them today. We need to be working on democracy issues, not just during the election, but throughout, and to ensure that we have a mobilized population to make their views known.
Thank you. I'd like to sort of try to combine two comments, questions that came in from the audience. One from Oscar Pineda, who says that I feel like we should be treating bad food like we treated Juul. I find it crazy that we banned e-cigarettes in 3 years because it was bad and predatory, but the sugar industry keeps a strong hold on politicians and allows to continue to prey on people at all ages. And so that's one approach of thinking about product bans, ingredient bans. Another comment from Jason Kumkowicz, I'm sorry if I'm mispronouncing your name, references the common market and the use of contract and bid language by schools to shift the way public dollars are spent to put their work towards the greater good, as he writes. So I wonder if the audience, the speakers can comment on these two different approaches of banning or using public procurement as a way to shift our goals, particularly around corporate influences on health and predatory practices, but also on some of the other issues that we've talked about today.
Yes, and yes.
That's exactly what I was going to say. On the first point, part of the delicate nature of our approach on marketing is some of the legal protections afforded to marketing generally, and it is not unconstitutional to market even if that thing is bad. That's not inherently unconstitutional. So what we've tried to really emphasize is the vulnerability of the audience, because that is illegal, targeting consumers who don't have the full capacity to make determinations themselves. And we are trying to make the public case that is what this type of marketing is. And that's the nature of the audience that it is targeting. I am all for us analogizing to other bad actors and bad corporate activity in other spaces. I don't think that there is a distinction. I think it's just a culture shift. And that's what we saw a lot in the past with some of these other disreputed corporate activities. And I think we're going to get there here. It's just harder because it's something that everybody consumes. It's not easy to demonize some people eating snacks because we all love snacks. That's something that people enjoy. And so it's a harder public lift for us, but not one that I think is insurmountable.
I also wanted to respond to the comment in the chat from Oscar about soda vending machines in every building, not having water fountains in schools. You know, an incredible amount of work has been done over the last decade plus to change the food environment in schools and to remove high sugar and unhealthy foods in vending machines, a la carte lines in the cafeteria, et cetera. There's a lot of work to be done, but really what the school food environment looks like really ranges a lot from school to school and school district to school district. And another thing I'd like to point out is that not all school cafeterias are created equal. There are some that are set up to do scratch cooking, and there are others that can refrigerate and warm up, and that's it. And so some of the states that have passed Healthy School Meals for All legislation have included money for equipment grants to really enhance what cafeterias and schools are able to do. And by including language about that, those coalitions have been able to draw in school nutrition professionals and other partners. Additionally, some states have included language and money for more local foods, and that has brought in farmers and community food advocates and expanded the groups that are working on that legislation. So I think that's interesting.
Thanks.
And
I wonder-
picking up, Alexis, on your comment of there have been, and I agree, big successes in changing school food environments, not in every school, but in many schools. And I think that has led us to think about a concept in our Food Policy Institute that we call denormalizing harmful industry practices. And we saw that in tobacco, and it became accepted. Most people agreed that the right to breathe clean air was stronger than the right for the tobacco industry to advertise its products. And I think we need to be denormalizing the marketing of unhealthy products. Here at City University of New York, we're beginning a campaign to persuade City University of New York not to renew a 10-year contract with PepsiCo for what are called pouring rights, the right to exclusively use Pepsi products in cafeterias and vending machines. That contract runs out next year. We're hoping that CUNY will not renew it and will come up with a way to make healthier beverages available to our students. And so I think every institution can take steps to work at their own level, as well as working for, there's some legislation in the state Senate that would prevent universities from having exclusive pouring rights contracts with unhealthy food marketers. So we can work at multiple levels to achieve synergies and make them moral arguments as well as economic and health arguments.
That's great. And I'd like to point out Jen's comment in the chat of the synergy between the Healthy School Meals for All campaigns and reducing the impact of predatory marketing, because with universal free school, food nutrition literacy, as Jen writes, could become a regular part of the curriculum and the school day. So I think looking for these connections across the different domains that we've been talking about, but others in food nutrition and health would be really valuable. And I wonder, Alexis or Susanna, if you've addressed this issue of the role of universal school food enabling the both education of, but also mobilization of young people to fight for healthier food.
Could you elaborate just a little bit more? I want to make sure that I'm answering the correct question.
Yes, I don't want to paraphrase Jan, and you're welcome to chime in, Jan, if you'd like. But the idea that if everyone is involved in eating school food and it becomes universal, then it becomes a place for education about food, not just a place to feed students lunch, but it becomes part of the school curriculum, part of the school day, and then can help to mobilize students and help them learn about predatory marketing and challenge predatory practices.
Okay, well, I can't speak to the younger population, so maybe Alexis can, but I think I think with the national strategy that came out, the food for all, like for us, it was like, who is for all? Does that include K through 16? If it did, then we could have this conversation, because I think that's an important part, right? Is that, we have students who were food insecure and on school lunch during elementary and high school, but that's something that doesn't continue once you become a college student, because all of a sudden maybe all of your problems just all go away. So I think in terms of healthier food environments, that's something that we're trying to do with the food pantry system that we have. Our food pantries partner with local agency, food banks, local farmers. Some of our campuses have their own campus farms. So when we have our food markets or food pantries, we try to provide healthy fruits and vegetables. We're also somebody in the chat, I think, had brought up this teaching kitchen at UCLA. So some of the campuses are also doing teaching education curriculum on how to meal prep, how to create a grocery list, and trying to bring it back to like healthier meals at home. UC Santa Cruz has a great model where they create healthy meals on campus, and they're donation based, and students can come in and get a really great meal. So those are some of the ways that we're trying to teach our college students about healthier meals, healthier environments. And so maybe Alexis, you can talk a little bit more about school age children.
Yeah, well, this question kind of prompts two things for me. The first is that, a recent study from Tufts, showed that school meals are one of the healthiest places where kids get some of the healthiest meals that they have access to. And that's something that I think not enough people appreciate, because everybody has an anecdotal reference point to school meals, or they have a view of what they are that might not be accurate of what's really happening in school cafeterias these days. And in fact, when we did our polling and focus groups on the topic of free healthy school meals for all, we gave people the fact, that school meals are one of the healthiest places for kids to access food. And it just didn't resonate with people, even though it was a fact. They weren't willing to run with it. So I think there's a lot of work to do to really promote like the quality food that is available through the school nutrition programs. And then also I had the opportunity to attend the National School Nutrition Association conference earlier this year. And there was surrounded by hundreds of school nutrition staff, and they do so much work that I think goes unnoticed in terms of taste testing menu items with students, having focus groups to see what meals they like the most, and then planning their menus accordingly, having students help with marketing of the school nutrition programs. They do so many innovative things. And I think if they didn't have to spend their time on so much paperwork and different eligibility categories for meals and the paperwork that goes along with it, they would have more space to do more of those ideas that would get to nutrition education, pulling more students into the school meal programs, and fostering a space for education and community.
Yeah, and I think building on Jen's comment and comments she's made in the past about universal school food, if school becomes a place for everybody to participate in an activity during the day, and it's not only about providing kids with nutritious food, it enables the school food program to be part of the civics curriculum, to be part of the social science and science curriculum, and then potentially becomes a bigger place and a bigger activity to help students really get engaged in changing food policy, even if they're in high school, or hopefully when they get a little bit older and can vote and can become more active in civic activities. There's one comment from Michael Garahan, a suggestion from after the White House conference was to help food entrepreneurs. I don't know if that's an organization or just a concept, but cottage food entrepreneurs And California, he mentions, has over 220 micro home restaurants. I wonder if anyone has comments on the notion of entrepreneurship in the issues that each of us have been grappling with. Healthy food for young people in school, food security for college students, and sort of reacting to corporate influences on the food industry. Does the role of entrepreneurship play any role, or can it play a significant role in changing food environments? No comments. If there are no other comments from the audience, we are approaching our time, 12:30, and I'd like to reiterate that we would like to continue this dialogue after our meeting ends today, and invite everyone who participated and your colleagues to continue to work with the Urban Food Policy Institute and the individual organizations that have been represented on today's forum to think through strategies for operationalizing some of the broader goals that we agree on that emerge from the White House conference, and to think about concrete strategies that we can put into practice at different scales, at the local, state, and national scales, but also in our organizations, to advance the goals expressed by the White House conference and follow-up report. So with that, I'd like to bring this session to a close and have everybody thank the speakers who participated today, and hope that you'll share the Zoom link that will emerge from the conference with your colleagues, so that other folks can also participate in this discussion. And so thank you again for participating, and thank everybody in the audience for participating today and offering your comments and suggestions. And we will continue this dialogue into the future. So thank you again, and look forward to staying in touch with each of you.